Hello, this is Stephen Violi from the Psychology Webinar Group, and tonight we have Susanna Mintermeyer, who is a specialist in quite a few things actually. She's studied traditional psychology, and that's where she's come from, and she does like to specialize in tonight's subjects, which is autism, ADHD, ADD, and OCD, and she has a bit of a different view of it. For those of you who watched the TED talk that I put up today on our Facebook page, which was very similar to the way it was a talk from someone who had autism, and it's quite relevant because it's similar to the way that Susanna um, teaches her clients. And so, Susanna, I will introduce. I will go on to the next slide there. This wants to work for me. Hello, that's me. Probably should have gone there before, but hello, Susanna. How are you? And welcome.
Hi, Stephen. Hello.
How are you?
Great. Thank you for having me. It's
That's
awesome.
now. I think there might be a little bit of a lag, but that's okay. We can forgive you being in Rome and we're in Australia, so we're definitely networking here, which is great. Spreading some really good information. So, would you like to tell us a little more about yourself?
Sure. So my name is Susanna Mittermeier, and I'm a clinical psychologist and have studied in Sweden, actually, and I'm born in Vienna, Austria. And I have been in the psychiatric field for a couple of years now, so many years I can't even count anymore. And the thing is that when I started out in psychiatry using traditional methods like psychotherapy and neuropsychological testing, I was trained in a very traditional way, like most psychologists. And when I started out in practice, like really meeting real people, I was kind of stunned that what I was taught didn't really match the the things, the people, and the situations that I would meet. And everything, I was starting to ask questions because the perspective that was handed to me from my education, as it is for most psychologists and therapists and psychiatrists, is that you constantly are looking for the wrongness. You're constantly looking for what doesn't work, and then you go into trying to analyze and understand what doesn't work. And what I found is that that approach doesn't really work because it constantly looks for what doesn't work, and where you already decided that there is something that doesn't work. So you already come from the assumption that there is a wrongness. And for me, that never really matched what was truly up, and especially meeting people with those diagnoses, which we're going to talk today about, ADHD, ADD, OCD, and autism. Especially with these people, I was stunned, I was surprised that that approach was not correct at all. So the talk we're going to have today, I actually call it From Disability to Ability, and I call people with ADHD, autism, and ADD and OCD the X-Men, because it kind of like is the movie The X-Men, if you have seen it, the sci-fi movie, where there are people who are so different that they are considered totally wrong, but in fact they are a mutation of the species. And this is kind of like what I found with these people, because the perspective we have been handed is that there's a wrongness, there's a disability, they're handicapped in whatever way. And if just as I don't know if the people listening know what these diagnoses are, but autism is clear, and ADHD, attention deficit hyperactive disorder, ADD is attention deficit disorder, and OCD is obsessive compulsive disorder. And so what we have learned in normal psychology and therapy is that these diagnoses are handicaps. There's something, it means that these people don't really function the way they should function. And before I keep on babbling, can you hear me well?
Yes, I certainly can. Can you? Yeah, I
Stephen,
just
is
had
all well?
Yeah, I just had myself
Oh,
on
okay.
mute,
Awesome.
so that's why there's a little bit of a lag for you to hear me, but that's okay.
Okay,
We
awesome.
can hear you very
All
clearly.
right.
Perfect.
Okay, cool. Great. Cool. I'm happy. Great. So I'll keep on babbling. So the thing is with those diagnoses that yeah, so it's a handicap. It's seen as a handicap in this reality. And what I found is like when I started to work, it's like everything just got turned upside down 360 degrees a couple of times because every time I used the traditional approach of looking for what doesn't work, I just get thrown out of the curve, out of the out of the line, and I had to look at a different perspective. So instead of going into the wrongness, like the approach that I've learned doesn't work, I started to ask questions. I asked questions of, okay, so what is this really that's going on? What is possible with these diagnoses, with what we call disabilities that we haven't acknowledged? And opening question, so asking question always opens the door to greater possibilities. Um, the thing with labels and looking for wrongness is always an answer. It always, it always just confirms what you already have decided it is. So if you go and have the approach that there's a wrongness, there's a label, there's a handicap, there's something that doesn't work, a disability, you will only find evidence for that point of view. Because the thing is, our point of view creates our reality. So if you have the point of view that there is something wrong, you will always find an evidence for exactly that point of view, and nothing else that does not match that point of view can even come into your awareness. So, so when I noticed that the approach of looking at the wrongness doesn't work and start to ask questions, a totally new world, a totally new reality opened up, and I could actually start to receive my clients in a totally different perspective. And it also opened it up the door for me to learn so much more of what the capacities that these diagnoses actually are hiding. Because what if these diagnoses are actually capacities that we haven't acknowledged yet? And the world that opened up for me is just truly incredible. And when I started to have that different approach to people, I could receive the awareness that actually matched more what was